Assalamu alaikum, friends. This is Nadir in Chicago, and you're watching my channel, Knowledge for Quality of Life. Friends, last time we spoke about vitamin D, how it's related to raising the good cholesterol, which is HDL, and the story related to me. I wanted to share that story to put the context in the right perspective that where I'm coming from. Today, I'm going to take this subject to a next level, that we look into it. What is vitamin D? Why is it important? And how we can fix it. So let me share my screen with you. Know the D number. This material is from Grassroot Health Nutrient Research Institute. They are based in California. I could have said many things because based on what I've been reading all over the place since last 8 years, but I was struggling with this concept that how to put together things in a concise way so that it can be related to the individual, so that it can be meaningful and understandable to everybody, whoever is going to be watching this. So I requested Grassroot Health, and they provided me this information, and I'm going to share with you here. So basically what they are saying, that know your D number. This is a guide, sort of, understanding vitamin D, testing and results. They are targeting for vitamin D level of 40 and above. Precisely, we will look into in further few slides that 40 to 60 is what they call it optimum. What is vitamin D? It's a vitamin or nutrient, and at the same time, it is a hormone. Basically, vitamin D is a precursor to a hormone, which is produced by, once it gets processed through the kidney, that hormone is, we call calcitriol. And that hormone provides all the raw material for every cell of our body for its proper functionality and various processes. So in other words, this vitamin D impacts each and every cell, each and every tissue, each and every organs in our system to keep us healthy. Why do we need vitamin D? Because in the earlier 1900s, they used to think that vitamin D is a bone vitamin and it's going to prevent kids from the rickets. Amongst the kids in the early 1900s, this curving of the bones has been happening, and it's going to prevent from bone softening, which we call osteomalacia in adults. But according to the new research in the last 12 to 15 years, the deficiency in this potent vitamin has been linked to numerous non-communicable diseases, such as osteoporosis, immune function, autoimmune diseases like diabetes, multiple sclerosis, several cancers, including breast cancer, colon cancer, lung cancer, lymphoma, and prostate, high blood pressure, pregnancy complications, and cardiovascular diseases, and etc., etc. I'm not listing many health conditions here, which I have come across in my studies. The Grassroot Health Panel of Experts, these are 48 leading experts around the globe. They are vitamin D experts. They've been studying almost for their life this potent hormone, and they have shared their research, their findings in disease prevention and keeping us healthy. And they are suggesting that the level of vitamin D in our serum levels, when we say serum means blood level, which we call 25-hydroxy, should be in the range of 40 to 60 nanograms per milliliter, or 100 to 150 nanomoles per liter for disease prevention. Of course, this is for disease prevention. And these are the different units which we are mentioning. So just keep that in mind, that these are the different units depending on which country you are. Vitamin D deficiency, as we said, affects each and every part of our body. So if you look at these individual system of our body, like brain, immune health, respiratory system, circulatory system. So each system controls certain ailment conditions, and if vitamin D is deficient, we can be compromised in certain health conditions in these areas, like depression, anxiety, Alzheimer's disease, dementia, ADHD, autism, in health, immune health system, like vitamin D is considered as an immune response modulator, which I will talk in a separate vlog, that what it does in modulating the immune response system. Then it affects our lungs, how we respond to colds and flus, pneumonia, ARDS, asthma, tuberculosis. The seasonal effect of this thing, that flu normally happens by the yearly basis, that by the end of October or early November, and it lasts through February or March. This is the colder months, basically. And that's been observed and data collected, that during these colder months, we are not exposed to sunlight, so our vitamin D status almost at the trough, at the lowest level. And these viruses are very active. Of course, our immune systems are at the low, since our vitamin D is at low, and then we are exposed to these viruses. And of course, if our immune system is compromised based on our D status and other health conditions, of course, of severity of those ailments are going to be accordingly. So if you look at the pancreas, diabetes and other autoimmune diseases like diabetes, pancreas regulates insulin through beta cells. These beta cells has VDRs attached to it. Now, when we say VDR, means vitamin D receptors. Now, these VDRs, I call it as a chip, which nature has embedded at various cellular levels in our body. Through all these systems which we are seeing here at different parts of our body at a cellular level, nature has embedded that chip, VDR, which craves for vitamin D raw material. And if those cells, those VDRs are deprived, of that raw material over the long-term period, those cells don't function the way their nature has designed for them to function, and those cells die. And of course, if they don't respond the way they are designed for, of course, we are going to see the different issues in our health accordingly. Then intestines, because intestines are where, lower gut is where the vitamin D gets absorbed. Then bone issues, rickets, osteoporosis, fractures. It's basically D is the raw material. Of course, there are many other factors which we will talk about it in the few next vlogs when we talk about osteoporosis and different testing and all that, which I've gone through for my wife, and what we are dealing with, what I came across with. But D is the basic raw material. D is the basic raw material, the basic element. Then you have muscles issues, neuromuscular pain, weakness, injury. Then we have many issues with the pregnancy, infertility, preterm birth, cesarean sections, prenatal complications. All these are related to severe deficiency of vitamin D. Then we have skin-related issues like psoriasis, eczema, many skin pigmentation related issues with severe deficiency of vitamin D. Because remember that at cells in the skins, these VDRs are left for a reason by nature, that it needs to function the way it should by receiving the raw material from vitamin D, so that these cells can function properly and keep us healthy at various cellular levels. Then various cancers, autoimmune disease, multiple sclerosis, psoriasis, and so on and so forth. These, by no means this is a complete list. These are few listed issues which are listed here, but there are slew of many others that can be listed here, everything. So how do we get vitamin D? Basically, it's through the sun exposure. That's how nature has wired us. Our liver produces almost 75 to 80% of the cholesterol. Cholesterol is a precursor to the vitamin D. It means that cholesterol's chemical name is 7-hydroxy. 7-hydroxy. When it receives the sunlight from UVB rays, right, and it converts that 7-hydroxy to 25-hydroxy, which is the inactive form of vitamin D, which flows through our blood. And then it goes through the liver, it gets activated, and then it gets sent to kidney. Kidney processes it further and converts into 125-hydroxy. Then it becomes the hormone, which we call calcitriol. And that calcitriol is responsible for providing, that hormone is responsible for providing all the raw material at various cellular function through these VDRs, which are implanted by nature throughout our system. So basic primary source is sunlight. Then, of course, if sunlight is not available or we cannot get through sunlight, we have food sources, but unfortunately, there are not enough food sources out there which can get ample vitamin D in our system. Then the last resort would be left is supplementing. What we know so far that 40 to 60 is the optimum level, and this is based on nomadic lifestyle, not office lifestyle. That the way nature has designed us, that if we were to live, near the equator, just like our old ancestors used to live. And then most of our skin is exposed. There's a special topic which I'll cover in the next vlogs, that this is the natural level that needs to be maintained by those folks when they were not wearing too much clothes. They were just covering their private parts, and that's how the range they came up with. That's how the nature has wired us to maintain that level. With the nomadic lifestyle. But modern humans, we are not in that optimal range. So if we rely on food, so let's say, according to the media and TV shows, that milk, whole vitamin D milk, it does a body good. Of course, one glass of milk has 100 IU. So one has to drink 50 glasses a day to get an average 5,000 IU required to reach 50 nanograms for an average height person, 150 pounds of the body weight. Or you have to consume 10 salmon pieces. Now you tell me, who is going to drink 50 glasses of milk a day? Or who is going to eat 10 salmon a day to get 5,000 IU? Again, 5,000 IU seems whole a lot because it's international unit. IU stands for international unit. And sometimes, I hear from people that, 5,000 is a lot. But if I were to convert into micrograms, that's only 125 microgram. And 1,000 microgram is 1 milligram. So just imagine that, how small unit this is in microgram. And just to give you a flavor, that one caplet of Tylenol has, 500 milligram. Right? So we don't even think about taking 2 Tylenol as a first dose if we have a body ache or pain. So just keep in mind that, this is a myth that 5,000 IU is a lot. It is not. And we will talk more about it down the line. So can vitamin D deficiency also indicate a sunshine deficiency? Yes, of course. That if we are not supplementing, if we are not getting enough from the food, and if we are living the lifestyle indoor most of the time, or office lifestyle, which we are, unfortunately, most of the time we are indoors. And during the office times, we don't have that luxury to go out in the sun. And of course, seasonal effect is there, that, during winter, if I'm unfortunate that I cannot go in the sun, even though sun is there, I cannot make any vitamin D in winter because I'm in Chicago, I'm at a higher latitude. And if we are living above Atlanta, Georgia, we don't make anything. Of course, Canada is further north, so Canadian folks are at much disadvantage. So vitamin D through sunlight not only produces vitamin D in a decent amount, but with a healthy exposure, but also it provides many other benefits which we cannot duplicate in any supplement form. Like it produces nitric oxide, it produces melatonin, it produces a lot of other serotonin, beta endorphins, and et cetera, et cetera. So these are all the natural phenomena which happens inside the body when we are exposed to healthy exposure to the sunlight. When I say healthy exposure, means without getting the burn. Now, if I'm putting the sunscreen and I'm going in the sun, I'm not making anything because that sunscreen is blocking it. Okay. And we are talking about sun exposure, healthy sun exposure, right? And it varies from person to person, depending on the skin pigmentation of the skin, which individual carries. The lighter the person in the skin color, the shorter the duration of the sun exposure, otherwise you will get burned. And you will make in the same amount of D in the shorter duration. The darker the skin, you need to stay in the sun longer and you will have lesser chance of getting burned. Like for instance, I go in the summer for 45 minutes wearing my shorts and t-shirt. So at least 30% of my body is exposed to sunlight when I do the fast walk. And I'm picking a day when my shadow is the shortest. That's the rule of thumb. But there's an app which we can look into it down the line in a separate vlog, that how we can monitor that what is the best time to make vitamin D. There's an app called D-Minder app, and it's developed by these experts. And wherever you are on the planet, it pings you that what is your solar noon. When is your solar noon? What is the best time to make vitamin D? So that, when it pings you, you can go out in the sun and enjoy your, sunlight and make some vitamin D that way. But remember that, without getting the burn, getting burned in the sunlight. You don't want to bake in the sun, just like some folks do the sunbathing, right? And that's not healthy. That's not what we are talking about, healthy exposure. What other factors can affect the D level, right? D level affects the absorption effects from person to person, how we are made up of, what underlying conditions we have, what kind of nutrients we are consuming with, what time of the day, how we are taking it. If somebody is taking with an empty stomach, their absorption level is going to be very low than somebody is taking it with the full meal. Again, vitamin D is a fat-soluble vitamin, so you have to consume some fat with it. So it can vary up to 6 times. So for instance, if a person, one person is taking vitamin D of 4,000 IU a day, can produce 25 nanograms of vitamin D serum level in his or her blood. Other individual can produce the same, with the same amount, 4,000 IU at 60 nanograms per milliliter. Totally depend on an individual. That's how we are all made different by nature. So we have to calibrate, we have to design, we have to customize our dose, that what I am made up of, what is good for me, and go from there. So one size fit doesn't suit here. One size doesn't fit everyone. We cannot use that proverb here, that some folks said that I've been talking to, I take vitamin D 4,000. How much is your level? Because body doesn't care how much I'm taking. Body cares that what is my blood level. That's how the body is going to provide the raw material to the various cells for the functionality of proper processes, right? So it doesn't matter how much I'm taking. I have to be in that 40 to 60 range that is required for this body to function properly, to keep me healthy. What are the factors that affect one's vitamin D level? As I said, that skin pigmentation is a big factor, right? Lighter the skin, the shorter the sun exposure time to make the same amount of vitamin D than the darker skin people, right? Then sun exposure itself, where are you located? If you are on the higher latitude, you are at disadvantage, particularly in wintertime, when you are not going to make anything. What time of the day? Every sunlight you are not going to make vitamin D. You have to be sometime, in the range that, a rule of thumb is that, when you cast your shadow, the shortest means sun is right above your head, basically. That happens somewhere between noon to 2 p.m. when the sun is at its peak. That's when you make vitamin D. And that D-Minder app reminds you, if you set up for, reminder that, when is my time, depending on the location of your latitude and longitude where you are situated. And it does very nicely, and it keeps track of it. And how we can do it, this sun exposure thing is that, it's very crucial that, you don't try to get everything through the sun exposure and getting into the risk of getting the sunburn. You take some sun exposure, which is healthy, and make it difference with the supplement. There's a possibility that way, right? For instance, I take 5,000 during the summertime, and in winter times I jack up to 7,000 IU. So because I don't get sun exposure in the summertime, so that keeps me, in the same range throughout the year of my vitamin D status where I want to be, right? Then body weight and BMI is another factor. A heavyweight person is going to require more vitamin D, more sun exposure if you are getting to the sun. And if you are supplementing, you need more vitamin D. Somewhere I read in the literature that, higher BMI people requires as much as 3 times more than the normal weight person. So having a higher BMI is also one disadvantage. That's why we say that, lighter the person, better it is. So that's another factor which impedes our vitamin D status. Then genetics is another factor. Then, of course, as I said, the food and supplement. Food has very minuscule amount of vitamin D, but everything counts. You have to account for that how much you are getting through the food, depending on your diet lifestyle. And whatever you need, you can supplement with the rest of the supplement. Then age of an individual. As we grow older, our absorption through sunlight goes down. That's the nature. That's how it works. Our system slows down. So we have to make the rest with the supplement with that. So basically, this vitamin is from cradle to grave. It's not a vitamin of choice. It's a vitamin of survival, right? If we want to keep our health intact and from we want to protect ourselves from the disease, multiple diseases. Then digestive issues. Some people have digestion problem. Some people have removed gallbladder. So if you don't make enough bile, then your level is not going to come up, even though you are supplementing. So you need to work with your doctor that if you keep taking the vitamin D and your level is not moving up, there is some issue. So you have to go to the specialist, endocrinologist, who is specialized in the endocrine system of your body, and then work with him that, why my body is not responding to the vitamin D level. I'm taking so and so much supplement and it's not budging. And then other condition would be medication and other health condition. Some medications, some prescriptions have, counter effect with vitamin D absorption. So you need to work with your health provider, your doctor, that, okay, I'm taking vitamin D and my numbers are not coming up. So what are the odds, or what are the chances that, my medications is not getting interfered with my vitamin D absorption? So you need to work with your health partner. Then other cofactors impacts your vitamin D status as well, right? How it's going to get absorbed. So vitamin K2, calcium, vitamin C, magnesium, ferrous, which is iron, and zinc. So I will talk about vitamin K2 and magnesium in the separate vlogs, because these are the most important cofactors that improves one's vitamin D level. It gets absorbed, it gets a little bit boost, so to speak, it gives a boost. So let's say if you are getting with 5,000 IU 15 nanograms per milliliter, but if you incorporate magnesium and K2, you may get 60 or 65. It's going to give you a boost. But I will tell one thing for sure, that whenever somebody is supplementing vitamin D, K2 is a must. K2 is a must based on the literature, right? But there are instances for some individual who are on blood thinners, right? So the K2 may work against those blood thinners. So you need to work with your healthcare provider, your doctor, and work from there, because this vitamin K2 can be working against your blood thinning drug. So you need to be very careful to talk to your doctor and go from there. All right. How can we know if you are D deficient? So these are the few conditions. It doesn't mean that you have to exhibit all these conditions to verify that you can be a D deficient. These are few listings. One can be D deficient without any symptoms. As we said, that this diseases which we call when the disease gets inside us, it remains inside us. The nature of the disease is something like particularly non-communicable diseases I'm talking about. It remains within us for a number of years before it appears in the form of symptoms. And by the time we realize that symptoms are there, probably that disease is already inside us. That's the nature of the disease, which we call insidious in nature, right? It's inside me without me knowing about it. But by the time I would realize, or I would know it, the symptoms would come out, and I go to a doctor that these are the symptoms. And then with further testing, the medical health professional is going to treat me for that disease, right? Because it's already inside me. So what we are trying to do is we are trying to take a proactive approach, right, for our healthcare rather than reactive approach, right? This is all we are doing. There are some godly tests which everybody has to go through. So we are not trying to eliminate everything, but whatever it's in our power to, underwrite the risk, that's all we are doing. And vitamin D is one of the most important factor for health in maintaining a good quality of life. That's why I thought that I should bring it to my audience. As we talked about it, the other nutrients important, I spoke about already the other ones, but omega-3 is also one of the most important thing. Omega-3 fatty acids, as vitamin D impacts our neuro health, our brain health. So we know that brain is nothing but blob of fat, and VDRs are also at the neurocellular levels, and vitamin D works hand in hand with omega-3 fatty acids for the health of our brain. So it's a very important cofactor. So either we can consume omega-3 fatty acids in the form of food or supplement, right? So I prefer to use in the form of food and to some supplement, right? So we'll talk about it in the later vlogs, that what can we do. So most important thing is know your D number, your base level, or if you are supplementing, what is your D number? Because that's what matters. At the end of the day, my blood serum D status is what it matters. Nothing else. How much I'm taking doesn't matter. What is my level? My body knows my level, and that's how my body is going to provide the raw material to various cellular levels for the functionality of various processes within the human body. Some countries report this vitamin D level in the lab reports in nanograms per milliliter. Some are in nanomoles per liter. So depending on if you are in the United States or some other countries, in US, it's nanograms per milliliter. In Europe and in Canada, it's nanomoles per liter. So 2.5 nanomoles per liter is equals to 1 nanogram per milliliter. So if you have a nanograms per milliliter and you want to convert to nanomoles per liter, you multiply by 2.5, or the other way around, if you have in nanomoles per liter and you want to convert into nanograms per milliliter, you divide the nanomoles per liter number by 2.5 and move on. How do you get your vitamin D results? You have to work with your doctor. You have to ask this test from your primary care health doctor, because this is not included in your regular blood work, which we go for annual checkup, right? It's not by default, it's there. According to me, it should be there because this is the basic premise of one's health. But unfortunately, it's not there, so you have to ask for it. And it's a very simple test. You go for a test. There's no fasting required. You go for a test, and within 2 to 3 days, you will get the test results. So you know your base number, and you can fix it. Your healthcare provider can help you in moving up by providing you supplements and further guidance. I will tell you one thing that, if you don't have health insurance, let's say, there are many outlet agencies, outlet labs who are doing vitamin D tests, which are nominal cost, and it's available. You can Google online resources, and few comes to my mind. LabCorp is there, Quest is there, Walking Labs are there, Myra is there. There are many more, but the range of the amount they charge is anywhere from $25 to $30 to over $200. So the huge range. So you have to shop around, and average range I have come across is under $50. So it's worth doing it. I do it twice a year, once every summer end, like in the fall, like September end, and the other one is by end of March. So I know when I'm coming from summer, I know what is my vitamin D by the end of summer. And I know when I'm coming out of the winter, what is my vitamin D, because I don't want my vitamin D throughout the year like a yo-yo, right? I want to have a pretty much uniform range so that, it provides whatever my body requires, whatever raw material my body demands, it's going to provide that raw material accordingly throughout the year. So the target level is 40 to 60 and 100 to 115 nanomoles or nanograms, depending on which unit we are working. There are few here links given, very informative. I'm going to include in the description. So for those folks who wants to take reading to the deeper level further, they want to dig a little bit deeper, I welcome you to do that, because the more informed you are, the better you are for your healthcare, and better you'll be in conversation with your doctor, right? So it's all about equipping ourselves with the knowledge. That's the society we are living in. If we call that, we are living in a knowledge society, what are we taking from it, right? That's the whole bottom line, right? So how it can be used. So education is not only earning bread and butter, but it should impact each and every walk of our life. That's what education is to me, at least. The optimal range is 40 to 60, and below 40 is lower levels. And if you recall that, in your lab, you will get your number, your lab results number of your vitamin D level. And then on the right side, they will be giving you a lab range, which varies from 30 to 100. It's a quite huge range, 30 to 100. If somebody is 30 and your doctor tells you that you are okay because you are in the range, based on the research, I will show you in the next few vlogs that you are not okay. You are not at optimum. That's what we call it, optimum. It should be around 40 to 60. According to me, it should be closer to 60 or above. And we will share some information in the next coming vlogs that for individual health conditions, that how it impacts your level. What are the probability of incidences of various diseases at various levels? How does your level compare? And is it high? Is it just low or just right? So you see that scale is here from 0 to 200 in nanograms, and 0 to 500 in nanomoles per liter. So lab range is 30 to 100. We are talking about, according to the Grassroots Health, they are recommending, these 48 leading experts are suggesting to keep between 40 to 60. 40 to 60 is the optimum range, they call it, right? And that is, of course, within 30 to 100 range. But this is the optimum. And then there are certain health conditions for which you need a therapeutic level, around 70 and 80. But in all sense, 40 to 60, closer to 60 is a good number to have to protect yourself and have a good health against in the prevention of all the diseases which we talked earlier. Supplementing with vitamin D3 to achieve optimal vitamin D level. So if somebody goes to do the test and base level comes in this range, right, less than 10, 15, 11 to 15, 16 to 20, these are all nanograms. This is the starting range, is base level. Then your doctor may suggest you to take, based on where you are on a scale, 50,000 IU per day for 6 days. And then after 6 days, you need to get retested. That did you make up? Did your vitamin D level move? Right? So you want to move from your base level to a certain level, right? And if it doesn't move, then there is something wrong. Then you need to work with your doctor that why it's not moving. You cannot just keep taking the D at 50,000 and assuming that your level is going to increase. No, it's not. If you have some other conditions and due to which it's not moving up, it means that it needs to be looked further by some endo doctor. And after this loading dose, which doctors normally call the loading dose, you have to maintain it after you achieve a target level. Because if you don't achieve, every vitamin has a half-life. So if you don't maintain that level, after a few weeks or months, your vitamin D is going to drop and you will be back to square one where you started from. So that's not good for your health, for your overall well-being. So you have to keep maintaining with the maintenance dose afterwards. So if you don't follow the loading dose phenomena, you can straight go to the maintenance dose. And this chart tells you that. So if somebody is less than 10 nanograms per milliliter, you have to be, your daily dose should be 7,000 to 10,000 IU. Again, remember that this is in IU, international unit. You have to convert into mcg, micrograms. It's very small number in a way. And then you have to take 2 to 3 months. Of course, 3 months is the plateau time that you reach the maximum level, and then you get retested after 3 months. I have explained in my previous vlog in detail that how it plateaus and what calibration needs to be done. So you need to make sure that you check my previous vlog. Then D calculator is there on their website, right? You can go to click this number, click this link, hyperlink, and that calculator is going to open. So if I want to calculate my base level, let's say there's an individual who has 150 pounds of body weight. If you are in kg, pick this unit. And current daily supplement, he is not supplementing or she is not supplementing anything. So 0 number, right? And then current serum level, let's say first ever you got tested and you got 20 nanograms. And your target level is 60, right? So your target level is desired serum level is 60 nanograms and IU. Of course, it's not nanomoles. If you are in Canada or in Europe, you pick your units accordingly. And then click calculate. It's going to give you maintenance dose for 3 months. One would need 8,000 IU, which is 200 microgram per day. 50% of the people will achieve the desired serum level 60. Why they say 50% of the people? 50% will not reach that level with this dose. Why? Because you see that earlier we discussed that everybody responds to vitamin D differently. Because we are made differently by nature. We may have underlying conditions. Our body weight is different. We are all different. So we are going to get absorbed differently. So you cannot say that one size fits all. right? So you have to customize your condition, and your healthcare provider should work with you hand in hand to help you in that customization, right? And once you customize that dose, that is forever, you can keep up with that dose, right? And then if 90% of the population takes 10,000 IU, they will guaranteed hit 60 nanograms per milliliter. But that's a pretty heavy dose. You may not need it. I'll tell you my example. I have a family of 5. I calibrated each and everybody's dose, from base level to everything. And my mom, who's 98, she takes only 2,000 IU. And you know what her level is? Her level is 80 nanograms. She is absorbing vitamin D phenomenally well, right? So I don't need to give her 5,000 or 6,000 or 8,000 to make 80 nanograms. No, if she's making, 80 nanograms, in disease prevention and with only 2,000 IU, why would I give anything more than that, right? So that's why I said that, you need to calibrate your individual dose. Let's close this calculator, and that's about it. And these are a few references here. Research references. And what I will say at the last, one thing that, this vitamin D is so crucial that I would say that, if we are deprived of oxygen for 5 minutes or over, probably will be dead due to the lack of oxygen. But if we are depriving ourselves from this vitamin, this potent hormone, then we are opening, so to speak, doors for various diseases, various issues, which is down the line, and I don't want anybody to be in the reactive mode. I would rather want my community, my family members, my friends, my relatives in the proactive mode, so that we can do to a certain extent in disease prevention. Hopefully see you soon. Bye.